And Catherine mentioned health IT. Health IT is something being promoted now by both parties. It was a big thing by Mrs. Clinton and Newt Gingrich about half a dozen years ago, and now it's, there's billions of dollars being spent on it. And here's some facts that should be of concern to you all. There are 42 million electronic health records that have been breached or compromised. 42 million records. That's a lot of records. Each year, at least 250,000 Americans' health ID is stolen. That means 250,000 Americans' health ID is stolen. I mean, these numbers should blow your mind. Think about the information that's out there now, and as all our records go online through mandates and subsidies, these numbers are from Health and Human Services, and I can give you the references. I have them back there. And as your health information starts going online, you can imagine more and more access to this information nefariously. I mean, I have concern for the good access without consent, but you can imagine the nefarious access without consent. And some of the things you all can consider as you move forward in putting policy, implementing policy, or promoting laws, or passing laws that eventually become policy to be implemented, is privacy and consent. People should be able to opt out of any system, or perhaps even opt into the system if they so choose. You should not mandate anyone to participate in anything. This is still America. We should be a free country. Americans should have to consent, should be given the right, they already have the right. The right should be recognized to consent to the release of their healthcare information to anyone. I mean, you might have very, very, very narrow exceptions. Perhaps someone's found unconscious, and you might need to access some information immediately just for their life, but very, very narrow exceptions. And when it comes to health information technology, they're talking about these interconnected databases. One thing I found was interesting is I went to see a doctor about a year and a half ago. He gave me one of those thumb drives with all my records. I mean, he took up his notes and he just downloaded everything he needed to, and there was my health information record. Now, you could take that and I would imagine, be really, really simple. There's got to be software companies that can create like a health bank or a health vault. I think there's actually a bill in the Senate called the Health Bank or Health Vault Bill, where individual Americans could create their own records online, their own records, not controlled by the insurance companies, not controlled by the government, not controlled by a third party, but their own, easily accessible to them. So information from the radiologist can come in and be segmented, and information from the cardiologist and their psychiatrists, and segmented as they want, and protected in such a way that when I go, for instance, to go, I don't see a cardiologist, but if I went to see my cardiologist, I could give her access to that specific information without giving her access to everything. There's no need for everyone in the medical system to have access to my information unless I consent to it. And the technology has to be available today. So please remember, consent, opting in, or if it has to be opting out, and that there has to be technology already available or in the works that would allow health information technology to flourish and benefit the doctors and the patients in the healthcare system, but also protect medical privacy. I'll leave it at that. Thank you.